Hey everyone, welcome back to the channel. If you're new here, make sure to hit that subscribe button because today's story is one that will make every healthcare worker's heart sing. Have you ever been publicly criticized by a colleague who thought they knew better than you, only to have the tables turn in the most spectacular way? Well, that's exactly what happened to me in the surgical prep room, and the chief surgeon's reaction left everyone absolutely speechless. This story is about respect, experience, and why you should never assume someone doesn't know what they're doing just because they do things differently than you. It's also about standing up for yourself and letting your work speak for itself. Before we dive in, if you enjoy stories about humility, professional growth, and well-deserved recognition, smash that like button and drop a comment about a time when someone underestimated you. Alright, let's get into it. So this happened about 8 months ago. I'm a surgical nurse with 15 years of experience in the operating room. I've worked in everything from trauma surgery to cardiac procedures, from pediatrics to transplants. I've seen it all, and I've learned from some of the best surgeons in the country. Now, one thing you need to understand about operating rooms is that they're incredibly structured environments. Everyone has a specific role, and everyone needs to work together like a well-oiled machine. Lives literally depend on it. As a surgical nurse, my job is to prepare the sterile field, hand instruments to the surgeon during the procedure, anticipate what they'll need next, and maintain the sterile environment throughout the surgery. It requires focus, skill, and years of experience to do it well. I've always been known for my efficiency and my attention to detail. Surgeons request me specifically because they know I'll have everything ready, I'll anticipate their needs, and I won't make mistakes. It's something I take a lot of pride in. Our hospital recently hired a new surgical nurse named Derek. He's 28 years old, fresh from a prestigious hospital in New York, and he came in with a lot of confidence. Maybe too much confidence. Derek graduated from a top nursing program, did his training at a famous teaching hospital, and he made sure everyone knew it. He had this attitude that his way was the only right way, and anyone who did things differently was clearly doing it wrong. Now, I'm all for learning new techniques. Medicine evolves, and we should always be open to better methods. But Derek wasn't interested in collaboration. He was interested in showing everyone how much smarter he thought he was. The day of our story, we were preparing for a complex spinal fusion surgery. The patient was a 52-year-old man with severe degenerative disc disease who'd been in chronic pain for years. This surgery would take about 6 to 8 hours and required absolute precision. The surgeon was Dr. Patricia Hall, our chief of orthopedic surgery. Dr. Hall is a legend. She's been practicing for 30 years, has trained hundreds of surgeons, and has hands that can do things most people can't even imagine. She's also no-nonsense, doesn't tolerate drama, and respects competence above everything else. I arrived at the prep room at 6 a.m. to start setting up. Spinal surgeries require a specific instrument layout, and I have a system I've perfected over years of working these cases. It's efficient, it's organized, and most importantly, surgeons love it because they can work faster when everything is exactly where they expect it to be. Derek was assigned to assist me on this case. It would be his first major spinal surgery at our hospital, so I plan to walk him through my process and help him learn our protocols. I started laying out the instruments in my usual configuration. I arranged them by stage of surgery, all the initial incision instruments together, then the retraction tools, then the specialized spinal instruments, then the hardware for the fusion itself. Derek walked in about 15 minutes after me, looked at what I was doing, and immediately made a face. "What are you doing?" he asked, his tone already skeptical. "Setting up for the spinal fusion. Dr. Hall will be here in about 45 minutes. That's not how you set up for a spinal case." He said it like it was a fact, not an opinion. I kept my tone friendly. "Well, this is the system I've developed over the years. It works really well for Dr. Hall's preferences. At my previous hospital, we used a completely different configuration. The way you're doing it is going to slow everything down." I took a breath. Different hospitals have different protocols. Dr. Hall specifically likes this layout because I've worked with some of the top spinal surgeons in the country, Derek interrupted. "Trust me, this isn't the right way." He actually started moving my instruments around, rearranging them into what he considered the correct configuration. "Derek, please don't move those. I have them organized specifically. You're organizing them wrong." Look, I know you've been here a long time, but that doesn't mean you can't learn better techniques. The surgical world has evolved. The condescension in his voice was hard to miss. He was essentially telling me, someone with 15 years of or experience, that I didn't know how to do my job. Other staff members started arriving. Another nurse, the anesthesiologist, a surgical tech. They could sense the tension immediately. I maintained my composure. Derek, I appreciate your input, but I need to set this up according to Dr. Hall's preferences. She's very specific about her instrument placement. Then maybe Dr. Hall needs to be introduced to modern techniques too, he said, loud enough for everyone to hear. The other nurse, Jennifer, caught my eye with a worried look. Everyone knew Dr. Hall's reputation. She was brilliant, but she did not appreciate people messing with her or setup. Derek continued rearranging instruments, talking the whole time about how his previous hospital was ahead of the curve and how smaller hospitals sometimes get stuck in outdated methods. I tried one more time. Derek, I'm going to ask you to stop moving the instruments. This is the setup Dr. Hall expects, and changing it will cause problems during the surgery. He actually laughed. Cause problems? The only problem is that you're resistant to change. This is why experienced nurses sometimes become obstacles to progress. They get set in their ways and refuse to learn. That stung. But I kept my cool. I understand you're used to a different system, but every surgeon has their preferences. Dr. Hall has been doing spinal fusions for 25 years. She knows what works for her. And I've trained under surgeons who literally wrote the textbooks on spinal surgery. I think I know what I'm talking about. At this point, the entire prep room was watching this unfold. The anesthesiologist had stopped what he was doing. Jennifer looked uncomfortable. Everyone knew this wasn't going to end well. Derek had now completely rearranged my setup into his preferred configuration. Instruments that should be immediately accessible were pushed to the back. Tools that wouldn't be needed until late in the surgery were front and center. It was a mess. There, he said, satisfied. Now it's actually organized properly. When Dr. Hall sees how much more efficient this is, she'll thank us. Derek, this is not what Dr. Hall wants. I'm going to have to change it back. Why are you being so stubborn about this? Are you really so insecure that you can't handle someone suggesting improvements? Before I could respond, the prep room door opened. Dr. Hall walked in, already in her scrubs, her surgical cap on, reviewing something on her tablet. She looked up, saw us, and immediately smiled. Good morning, everyone. Ready for a beautiful spinal fusion. Her energy was always positive before surgery. Then she approached the instrument table and stopped. Her smile faded. She looked at the setup, then looked at me, confusion in her eyes. What is this? She gestured at the instruments. My heart sank. Dr. Hall, I can explain. Derek stepped forward confidently. Dr. Hall, I took the liberty of reorganizing the instrument setup using a more modern configuration. I trained at Manhattan General, and this is how Dr. Goldstein, he's published over 200 papers on spinal surgery, prefers a setup. It's much more efficient. Dr. Hall stared at Derek for a long moment. The room was completely silent. You reorganized my instrument setup. Her voice was dangerously calm. Yes, without consulting me. Well, I just thought. You thought. Dr. Hall set down her tablet. On the morning of a complex 8-hour surgery, you decided to completely change the instrument configuration that I have specifically requested for 25 years. Derek's confidence was starting to waver. I was just trying to introduce a more efficient method. Do you know why I arrange instruments the way I do? Dr. Hall's voice was sharp now. Do you know that my specific setup is designed around the biomechanics of my reach, the sequence of my surgical approach, and years of muscle memory? I trained with some of the best. I don't care where you trained. Dr. Hall cut him off. When you walk into MY operating room, for MY surgery, with MY patient, you follow MY protocols. Is that clear? Derek nodded, his face red. Dr. Hall turned to me. How long will it take you to fix this? About 15 minutes, Dr. Hall. Do it. We're pushing back the surgery start time. She looked at the scheduler. Let the patient's family know we'll be starting 20 minutes late due to an equipment setup issue. Derek looked like he wanted to disappear. But Dr. Hall wasn't done. She turned back to him. Derek, do you know who you just overrode? Do you know who this nurse is? He shook his head. This is Sarah Mitchell. She has 15 years of OR experience. She has worked with me on over 300 spinal surgeries. She knows my preferences better than I do sometimes. She anticipates what I need before I need it. Surgeons from other departments request her specifically because she's that good at what she does. Derek was staring at the floor now. Sarah has been in operating rooms when things went catastrophically wrong, and her quick thinking and skill helped save patients' lives. She has more experience in one hand than you have in your entire body. Dr. Hall's voice softened slightly but remained firm. I understand you come from a prestigious program. I'm sure you learned excellent techniques. But excellence isn't about doing things one specific way. It's about adapting to each situation, each surgeon, each patient. It's about respect and collaboration. She gestured to the instruments. Dr. Goldstein's method works beautifully for Dr. Goldstein. My method works for me. Sarah understands that. She's worked with dozens of different surgeons, and she adapts her setup for each one because she's a professional. Derek finally looked up. Dr. Hall, I apologize. I was out of line. Yes, you were. And you owe Sarah an apology, not me. He turned to me. Sarah, I'm sorry. I was arrogant and disrespectful. I shouldn't have dismissed your experience or changed your setup. I could see he genuinely meant it. The confidence had been replaced with humility. I accept your apology, I said. We all have different training and different experiences. The key is respecting that and working together. Dr. Hall nodded approvingly. Derek, here's what's going to happen. You're going to watch Sarah reset this table. You're going to observe exactly how she does it and why. Then, during the surgery, you're going to see firsthand why this configuration works so well. And if you're smart, you'll ask questions and learn something. Yes, Dr. Hall. I quickly began resetting the instruments to the proper configuration. Derek watched carefully, and I could see him starting to understand the logic behind the placement. See how I'm putting the initial retractors here? I explained. That's because Dr. Hall is right-handed, and this position means she doesn't have to reach across her body. It saves seconds, which adds up over an 8-hour surgery. Derek nodded, taking it in. And these specialized instruments for the fusion hardware, they're arranged in the exact sequence she'll use them. She can work almost without looking because she knows exactly where each tool will be. That actually makes a lot of sense, Derek admitted. Jennifer, the other nurse, chimed in. Sarah's setups are legendary here. Surgeons literally request her because their surgery times are faster when she's on the case. The surgery itself was a masterclass. Dr. Hall moved through the procedure with precision and speed. Every time she reached for an instrument, it was exactly where she expected it to be. The surgery that usually takes 8 hours was done in 6.5. Throughout the procedure, Derek watched how seamlessly everything flowed. How Dr. Hall barely had to look at the instrument table. How I anticipated her needs and had the next tool ready before she asked. After the surgery, as we were cleaning up, Dr. Hall pulled me aside. Sarah, I'm sorry you had to deal with that this morning. You deserve better. It's okay, Dr. Hall. He's young and learning. He is. But that doesn't excuse disrespect. She paused. You know, I've been thinking about creating a senior surgical nurse position. Someone who can help train new staff and maintain our standards of excellence. Would you be interested? I was stunned. Dr. Hall, yes. Absolutely yes. Good. It comes with a significant raise and the title of lead surgical nurse. You've earned it 1,000 times over. We'll make it official next week. I almost cried right there in the OR. Later that day, Derek found me in the break room. Sarah, I wanted to thank you for being gracious this morning. You could have really made me look bad, and you didn't. We all make mistakes, Derek. The important thing is learning from them. I learned a lot today. Not just about instrument setup, but about respect and humility. I came in here thinking my fancy training made me superior, but I was just being insecure and trying to prove myself. I appreciated his honesty. You have good training and good skills. You just need to remember that experience and wisdom come from more than just where you went to school. I get that now. Would you be willing to mentor me? I have a lot to learn, and I'd rather learn from the best. Over the next few months, Derek became one of our best surgical nurses. He was eager to learn, respectful of experience, and he dropped the arrogance completely. We actually became good friends. He told me later that the incident in the prep room was one of the most important learning experiences of his career. I thought expertise was about where you trained and what techniques you knew. I didn't realize it was about judgment, adaptation, and respecting the people around you. This whole experience taught me several lessons that I think about often. First, your work speaks louder than your credentials. Derek had the prestigious degree and the impressive training, but when it came to actual performance in the OR, experience and skill mattered more than the name of a school. Second, respect is earned through actions, not titles. Dr. Hall's defense of me wasn't about hierarchy. It was about recognizing competence and standing up for people who do excellent work. Third, confidence without humility is just arrogance. True confidence means being secure enough to admit what you don't know and to learn from others. Fourth, every workplace has tribal knowledge. Every hospital, every team has specific ways of doing things that work for them. You can't just walk in and assume your way is better without understanding the context. Fifth, the best leaders defend their team. Dr. Hall could have just quietly asked me to fix the setup, but instead she used it as a teaching moment and stood up for me publicly. That's leadership. Looking back on that morning 8 months ago, I remember how frustrated and disrespected I felt when Derek was rearranging my setup and dismissing my experience. But I also remember making the choice to stay professional and calm. I could have gotten angry. I could have made a scene. I could have pulled rank and forced him to stop. But I chose to trust that the work would speak for itself, and it did. The validation from Dr. Hall meant everything. Not just because she defended me, but because she recognized the years of dedication and skill that go into being truly excellent at what I do. And Derek, he's actually become a wonderful colleague. He still has confidence, but now it's balanced with humility. He asks questions. He listens. He respects the experience of others. Just last week, we were prepping for another complex surgery, and a new resident started to suggest changes to the setup. Derek politely stopped him and said, "Actually, let's watch Sarah set this up first. There's a reason she does it this way, and we should learn from her before suggesting changes." The growth was beautiful to see. I'm now officially the lead surgical nurse, and part of my job is training new staff. I always tell them the same thing. Your education gives you knowledge. Your experience gives you wisdom. But your humility gives you the ability to keep learning forever. So there you have it. My colleague mocked my technique right there in the surgical prep room, probably thinking it would get a few laughs or make him look superior. But the moment the chief surgeon stepped in and defended the method, my method, the entire room shifted. It wasn't just silence. It was the kind of silence where everyone realizes they may have completely misjudged the situation. And honestly, that moment became far more than just a professional win. It became a powerful teaching experience for everyone in that room, including me. The bigger lesson here? Never underestimate people based on assumptions or appearances. In any workplace, especially in high-pressure environments like medicine, you'll meet people who work quietly, who avoid the spotlight, who don't brag, who don't need to be the loudest voice in the room. But sometimes, those are exactly the people with the deepest wells of experience. That quiet, steady professional who does things differently might actually be doing them better because they've spent years refining their technique. That so-called old school method you're tempted to dismiss might be old school for a reason. It has stood the test of time, and it keeps producing reliable results. And that colleague you think you're smarter than? They might end up teaching you one of the most important lessons of your career. Respect experience. Respect the journey people have taken to get where they are. Stay humble, even when you're confident. Let your work speak louder than your ego ever could. And remember that every person you work with, even the ones you least expect, has something valuable to teach you if you're willing to pay attention. If you enjoyed this story, make sure to hit that like button. It really helps the channel grow. And subscribe if you want more real workplace stories, real lessons, and real moments that people don't usually talk about openly. Drop a comment below about a time when you were underestimated, or when someone surprised you with their knowledge or skill. I genuinely love reading your stories. They remind me that these experiences happen everywhere, in every field, and they connect all of us. Thanks so much for watching, and remember, excellence isn't about proving you're the smartest person in the room. It's about showing up, doing great work consistently, staying curious, learning from the people around you, and lifting others up along the way. That's what real growth looks like, and that's what truly sets great professionals apart.